last week, Joe Biden announced $100 million to put towards women's health research through ARPA. We're seeing other private foundations also saying this is really important. We want to put money towards it.
Welcome to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm your host, Logan Plaster, with my guest here, Sarah Nicholson with Babyscripts. Sarah, great to see you.
Good to see you too.
It's been an honor, really, to watch Babyscripts grow over the last few years. How old is the company?
We are just about a decade old.
Okay, a decade old. I've been following the company for the last 6 years, and I've watched as you've brought digital health and remote monitoring to expectant moms and really improved access to quality care for moms. So talk to me about kind of where Babyscripts is today, what the product looks like, and maybe just a little bit of that backstory if it's helpful.
Sure. When we started, there were really no solutions like this in the market. And now, 10 years later, we're at Vive, and we see a lot of players who are coming in with different platforms. So it's very exciting to see growth in the space. But we are a patient engagement platform and remote patient monitoring for pregnancy and postpartum. We can do everything from social determinants of health assessments, mental health assessments, blood pressure, RPM programs in the prenatal and postpartum period. So over the time, we've started to build our capabilities to really provide wraparound services to be able to care for that mom regardless of her risk level all the way through postpartum.
Okay. We're gonna get really practical because when my wife was having our second child, she had preeclampsia with our first, and so with the second she was concerned and really thinking about things, but we were in a place where getting to an OBGYN was a pain. So talk to me about, had she had Babyscripts, would that have been helpful to her? Kind of what that experience might have been like.
So she would have gone in for her first visit when she found out she was pregnant. Her doctor would have prescribed her Babyscripts, and she would have access to digital education through our app, gestationally specific. That's all approved by her provider. So it could be, what are the specific classes that I should be going to through my provider, and just education to help guide her. And if she were already at risk for preeclampsia, she would have been also given a blood pressure cuff, which we would monitor from the back end. So she could take her blood pressure throughout her pregnancy, and if there was something wrong while she was outside of the clinic, we would be able to alert her provider so that they can intervene. It also, for some patients who maybe it's harder to get to the clinic, we can reduce those visits so long as those blood pressure ranges are if they're healthy. So there's a lot you can do for busy women or for folks who are in rural areas who might have really hard access to care. There's a lot you can do with these virtual tools, but still have that connection and that safety net with their provider.
I think I had one founder tell me that something like 50% of U.S. counties don't even have an OBGYN. Does that
is
sound
correct.
Right?
There are many maternity deserts across the U.S. I know that I was just reading Kaufman Hall released a report on hospital financials, and it's continuing to say that rural hospitals are closing their obstetrics departments. So we're going to see more and more of this. So we really need to find scalable solutions to give care to those the birthing people who are in these areas.
Okay. So if I'm working with the platform, is there a telemedicine component? What are some of the other features involved?
Babyscripts doesn't offer a telemedicine component, but we can plug into whatever our customer is using. We do remote patient monitoring, so for blood pressure, for mental health, and it's really just that tech platform to connect the necessary stakeholders and direct them to their care navigator, their social worker, a WIC program, whatever it may be, when we're uncovering those risks.
Got it. You mentioned mental health a couple times. How are you using the platform to really think about postpartum depression, some of these really intense issues that crop up?
Yeah, I mean, if you look at the stats on maternal mortality, mental health is such a huge component to that, and it's particularly in that postpartum period. So we're deploying assessments in the postpartum period, but I think more importantly in the prenatal period to be able to look for trends and rising risk for those moms throughout the pregnancy so that we can give them access to behavioral health or make sure that their provider is aware to hopefully avoid a lot of those higher risk scenarios in the postpartum period.
Okay, so what does that look like? Is this like a questionnaire, like a prompt about how I'm feeling? Kind of walk me through some of that.
We use standardized assessments that are delivered at specific periods, and our customers are able to determine when those are delivered. It could be one per trimester, it could be every couple weeks, and then depending on the score of those assessments, one, we're able to alert a provider or whomever is necessary to let them know that there's a rising risk, but also be able to give immediate feedback to that patient around important resources, whether it may be different local community resources that they can connect with, or reading different materials, or meditation exercises. Well, depending on kind of the score, we're able to personalize the response and the education around it.
Interesting. How do you think about the platform in terms of how it plugs into longitudinal care? Obviously, somebody comes through and they use Babyscripts, and then they're launched into a life of other health issues. So how has Babyscripts connect to the rest of their sort of health choices or the rest of their life, really?
Well, we really try and ensure that someone who's going through pregnancy has those healthy behaviors so that they can continue those later on in life. We see our blood pressure programs have very high compliance, and this might be the first time that someone recognizes that that blood pressure is important, or that they may have a risk. And so we've seen that a lot of the users on our blood pressure programs start to learn the behavior in their pregnancy, and then continue to use that education postpartum. We know that patients who have preeclampsia or have gestational hypertension are going to continue to have higher risk for hypertension-related and cardio-related issues later in life. And so we really want to foster healthier behaviors, and then also with our platform, making sure they know who they could go to for specialists, whether it be during the prenatal period or postpartum.
You mentioned, here we are at Vive, you mentioned that now, after many years of working hard at Babyscripts, you're seeing the market mature and you're seeing more folks. What are some of the trends you're seeing? Obviously, some of that might be competitive, some of it is just rising tide lifts all boats. What are the trends that you're seeing in terms of digital, maternal care like you're providing from other companies?
We're seeing a lot of tech-enabled services that are providing wraparound care outside of just the normal prenatal care they're getting through their doctor. So lactation consultants, mental health, doulas. We're seeing a lot of that in some hybrid of virtual and in person, which is very interesting because we're also seeing from a national level new models of care that are being published. So in December, CMS released something called Transforming Maternal Health. It's a new model for pregnancy care that they're really trying to push out to various states. And it includes a lot of those wraparound services. And so it's really interesting to see that the policy and guidance that's being pushed out is kind of mimicking the companies that we're seeing in the space.
Interesting.
And for hospitals and health systems that are dealing with resource constraints, provider burnout, financial constraints, we need to figure out how to use technology to be able to scale what we know is going to work, but you can't always just put a human, to be able to do a lot of these services.
So the CMS regulations are aligning nicely with the work that you're doing. How does that translate into reimbursement?
Well, we're also seeing some changes in reimbursement. And that's great. We're seeing more remote patient monitoring codes that could be relevant in pregnancy. We're seeing different codes specifically for FQHCs that were announced in 2024, which is wonderful, to help fund some of these. But we're also seeing big dollars being put out through larger programs. So last week, Joe Biden announced $100 million to put towards women's health research through ARPA. We are seeing HRSA coming out with different programs, and we're seeing other private foundations also saying this is really important, we want to put money towards this. So it's really nice to not only see mechanisms for reimbursement start to bubble up, but also see larger commitments to funding the solutions to all these problems we've been talking about.
Do you feel like all those things combined, do you feel like you're in an inflection point for Babyscripts and the work that you're doing?
I think so. I mean, I've been with the organization for about 9 years, and it's wonderful to have that national coverage about the problem, but you can only talk about the problem for so long. So it really feels like we are at that point where we're ready to say, okay, let's actually fix this.
At scale.
Yes.
Not just nibbling at the edges.
Yes.
Yeah.
Yes.
I asked an inflection point question, not as it's not a trick question, because not every startup can be at an inflection point all the time. Sometimes you have to just kind of grind and do the work and grow each year, but this does seem like one of those situations where the regulations and the compensation, the market forces are aligning for a pretty significant shift.
We hope so. There will still be a grind. I mean, just because there's money doesn't mean that all of
Yeah.
our problems are solved, but we're ready to do the work, and
Yeah.
we know we're not the only solution, so it's great to meet other companies that are in the space that have that same mission, and how can we all work together
Yeah.
to address it?
Yeah, it's huge need. Love that you're working on this. Sarah, I appreciate getting to get an update again, and I hope it's an awesome year.
Great
All
to
right.
see you.
Thanks, Sarah.